When a patient comes into a provider interaction, they have certain biases and expectations. When these different goals don't get communicated well, patients will often leave the encounter with misinformation or lack of information about how to take their medications properly.
So when people are considering using urine drug testing, it shouldn't be to catch people, but rather as a way of opening up a dialogue and a discussion.
All opioids are not created equally. They can bind differently to receptors, they can have different adverse effects in patients, and it's quite a process in choosing what's the best opioid for any one given patient. We consider variables about the patient, and we consider variables about these medications amongst the class.
Pain is not pain until information gets to the brain. So the really peripheral and central sensitization refer to mechanisms outside of the brain that may lead to enhanced pain being experienced by the brain.
In the United States right now, we really have two enormous public health problems. We have a tremendous problem of chronic pain. And while it's no longer as sexy to talk about it as it used to be, we're an aging society, 50 to 70 million people have chronic pain. Those numbers are only going to increase as time goes on, as our society ages.
Once you have these uric acid crystals in the joint, your body looks at it as if it doesn't belong there, a foreigner, consider it similar to a bacteria, and your body then attacks the uric acid crystal. The trouble with it is these crystals cannot be digested.
Taking control of the prescribing is a long process, and it involves a commitment to what I would consider several months of really looking at where the practitioner stands, understanding the federal platform from a legal regulatory perspective.
In the assessment period, it is critical to understand the patient's experience, and so therefore you want to interview them and ask about the type of pain, its location, intensity, duration, and a variety of factors that might influence it, either making it worse or better.
Earlier in my career, I made the mistake of doing a lot of treatments, which meant the patients had to come back every week for another treatment. And they got temporary relief. And then I realized that it was better to empower them and teach them what they could do for themselves in their own homes to manage the pain and prevent it from becoming too bad.